This is a very common issue. It's called a tooth size discrepancy, and the majority of us have it to some degree. Now, how does that fit into your orthodontic treatment or the way your bite is? Well, some of you might know that you had previous orthodontic treatment and then a space opened right back up. Why is that happening, or why did you start out with spacing, especially towards the upper two front side teeth? That's where we see this the most commonly. So if we look at this patient here, and we'll just take a peek, this is another CT integrated model here. There's a space here, and you can see another narrow front tooth on this side. So this patient has a larger tooth size discrepancy than average, and the tooth size discrepancy is the proportion of these top teeth compared to the bottom teeth, but especially in this anterior front region. So the patient's complaint is previous orthodontic treatment and then the space opened back up. We want to address this so that you not only have space closure during the treatment, but there's more stability after the treatment. We don't just want to take care of what's the issue now. We want to give you a great result for the long run. There's a couple different options when we see these discrepancies. So that's a bit of patient preference, because we like to address what your concern is and how you would like to solve it, but also what's realistic and physically possible. So in this case, we have a couple of options. We also started out with some lower crowding, and so we are looking at going through adjusting the bite because there was too much overlap, and then bringing the teeth together and closing those spaces. So we are doing some adjustment on the lower here. There will be a little bit of a tighter proximity to the top and bottom teeth here. So this is the option that we love to shoot for because it just requires orthodontic treatment. But if we can't close those front spaces, ideally, there are two other good options for you. Especially if you have worn down front teeth or old restorations, oftentimes we'll discuss veneers if you're an adult, or composite restorations for younger children who might have that discrepancy and need some space closure after the orthodontic treatment. So we'll decide if it's one way or another in the beginning. We can always reevaluate for you, but we may go with that route, or we can do some reshaping on the bottom teeth. Sometimes there's a little combination of both, and then in other cases we might talk about teeth out, but usually we try and focus on what will be that great aesthetic outcome for you, and we'll work closely with their dentist to make sure that it's the best possible result for you and what kind of smile that you would love.